Do you remember this post-COVID bedtime story that inspired hope and cheer and went viral during lockdown?
Tell me the one about the virus again.
And so when we found the cure and were allowed to go outside, we all preferred the world we found to the one we'd left behind.
It's a really sweet video. But the idea that the world is going to be better for most people after the pandemic because of great realizations is a little out of touch with reality. Health emergencies rather than remedy broken systems just deepen existing inequalities in the short term. UN Deputy Secretary General Amina Mohammed says the global emergency is compounding existing imbalances for vulnerable and marginalized people. One of those imbalances is gender inequality. Men and women are roughly equally likely to be infected by the coronavirus. Even though men are more likely to die than women, women are being disproportionately affected by the impact of coronavirus. From health to economy to security and social protection, the impacts of COVID-19 are much worse for women, simply because they are female. The poorer and more marginalized the women were to begin with, the harder hit they likely will be. Here's how. Last year, 243 million women from around the world aged 15 to 49 were victims of sexual or physical violence perpetrated by their intimate partner. Emerging data suggests that domestic and sexual violence has increased in a number of countries since lockdowns began. COVID-19 has led to stress and tension around health and finances for millions of people from around the world. And this, coupled with the fact that lockdowns and isolation lead us to spend more time at home in confined spaces, means more women are experiencing domestic violence more frequently. At the same time, services that can help women are now less able to assist because they are overwhelmed, under their own financial pressure and faced with restrictions on their movement. The Malala Fund has drawn on data from the Ebola crisis in Sierra Leone to estimate that 20 million more girls could drop out of school even after the COVID-19 pandemic has passed. Girls are often the first to leave school when a crisis hits and the last to go back to school. The increased rates of poverty and household responsibilities brought about due to the pandemic pushes more girls into child labor, and even teenage pregnancies occur more frequently. During the Ebola outbreak between 2014 and 2016, teenage pregnancies more than doubled in Sierra Leone. Epidemics also reduce government funding and aid for education because funds are diverted to the health crisis. COVID has led to food insecurity and pushed poor families into extreme poverty and hunger. This means that families are more likely to marry girls off. It reduces their burden because they have fewer mouths to feed and could increase their income through dowry. Data is difficult to come by, but Faith Mongwani Powell, the chief executive of Girls Not Brides, says aid workers have noticed an uptick in child marriages in Latin America, Africa, and India. A UN report estimates that the pandemic will lead to an additional 13 million child marriages over the next decade. Female genital mutilation, the practice of cutting or removing female genitalia, is also on the rise. Wait, what? How? The UN says 2 million girls who would be safe from the practice are likely to undergo FGM because of the pandemic. COVID-19 is reducing funding and causing delays for FGM prevention programs. The UN has used historical trends on FGM to model how a reduction in FGM prevention programs would impact the number of girls cut, as well as estimate the additional number of girls who could be cut because of the pandemic. Girls being out of school because of COVID closures leaves them much more vulnerable to being cut, as people are idle and they are less capable to rely on wider social circle or peer groups. In Egypt, 3 girls were tricked into FGM by their father, who told them a doctor was going to vaccinate them against the coronavirus. Instead, they were injected with a drug that knocked them out, and then they were operated on. Even before this pandemic, women were already more likely to live in extreme poverty than men because of fewer opportunities and access to jobs. A UN report also says that when crises such as the pandemic, which threatened food security, hit, women are more likely to go hungry in favor of men and boys eating in 2/3 of countries. But even for employed women, the pandemic could have disproportionate effect. The pandemic has led to unemployment increasing everywhere, but data from the US and the UK say that more women have lost their jobs than men. The International Labour Organization says that 40% of all women employed in the world work in service-related industries such as retail or hospitality. With restrictions and fewer people going out, these are the hardest hit sectors. 60% of the world's informal workforce is also made of women. They're more likely to be lower paid, work part-time with little or no income security and social protection, which also leaves them particularly vulnerable. Women on average also already do 3 times more unpaid domestic work and care at home. With school closures, women could experience a greater burden on their time given their multiple caregiver roles, which means less time for work or even a permanent exit from the labor market.